Welcome to another edition of Health with Patricia, where we have honest conversations about issues affecting your health and well-being. And today we're discussing high-risk pregnancies. Which pregnancy is termed high risk and which is not? And my guest, Dr. Sefogah, he's a consultant obstetrician gynecologist here at Shape Healthcare Medical and Specialist Center, and he's going to give us all of that education. Dr. Sefogah, thank you once again for another time. High risk pregnancies.
Yes, thank you for having me.
When do we term a pregnancy high risk? And how dangerous is it?
Okay, so just like the name sounds, high risk pregnancy means that this pregnancy requires extra attention because it stands a greater risk of potential life-threatening complications. Okay. Now, no two pregnancies are the same. So there are some things that will increase somebody's risk of maternal, what we call morbidity, complications, and the risk of dying from the pregnancy compared to another pregnancy. And so if in our judgment, this pregnancy carries a higher risk of bad things happening, we term that high risk. It's basically just to help us to categorize the care so that you don't have this level of risk and you are receiving care at a lower level. So that if your risk level is here, you must receive care at a place and at a level where there's this level of expertise and then logistics to be able to manage the complications.
Looking at, not to cut you short, but in a situation where the pregnancy is high risk and looks like it will, the woman might end up dying because of that particular pregnancy, what do you do?
So we make sure we manage it at a level where the risk and the complications can be managed, handled effectively.
You don't terminate it?
Very, very rarely you end up terminating it.
Okay.
Which is part of the management. So take, for instance, the problem we call hypertensive disorder in pregnancy, right? Now, it just so happens that some people, when they are pregnant, at the stage where the placenta is developing, some chemicals get released that cause the woman's blood pressure to rise during the pregnancy. Okay. Now, this typically happens in the second half of the pregnancy. That's when it begins to show. The blood pressure begins to go up. Some just ends up as a high blood pressure in pregnancy. Some will have the blood pressure going up together with other organs affected, the kidneys, the liver, the lungs, the bone marrow, the brain. Then it becomes what we call pre-eclampsia. The pre-eclampsia can be mild or it can be severe. The mild one, the risk is not the same as if it is severe. If it is severe, it means that pregnancy has to end.
Okay.
If not, the next thing that would happen is that there's going to be what we call eclampsia. Eclampsia means the woman is pregnant, blood pressure is high, other organs are damaged, and then she now has convulsion, and that tends to easily cause mortality.
Wow.
So when the woman has eclampsia, which is categorized as severe, we need to end the pregnancy, regardless of how old the pregnancy is. The treatment to safeguard the woman's life at that point is to end the pregnancy. Because if you persist and you carry on, we're likely going to lose the baby, we're likely going to lose the mother, or both.
Okay.
Okay. Now, in that case, the losing of the baby or ending the pregnancy becomes the cure to keep the mother alive. Okay. Otherwise, and even that has to also be done early enough. Because otherwise, if you carried on until the kidneys are damaged, you still end up losing the baby, all right, but then the woman now lives her life with kidney failure. You have to keep you on dialysis twice a week for the rest of your life. Okay. Then we have other situations where the woman is pregnant and her blood sugar has gone up. We call that gestational diabetes. That also poses risk to the baby and to the mother. So that again is a high risk pregnancy, because if the high blood sugar is not controlled well, the babies sometimes they just die suddenly, particularly in the third trimester.
So wait, so are this particular things, like at what stage do they always show?
So during the first visit of every pregnant woman, we go through a series of checks and then some blood tests.
Okay.
Then we're able to put you at the risk level. Okay. So if at the first visit the blood pressure is already high, that is called chronic or pre-existing hypertension.
Okay.
It's a high-risk pregnancy. If you had diabetes or gestational hypertension in your previous pregnancy, even though you are normal, the blood pressure, the sugar is normal now, you are still high risk because those things can recur in this pregnancy.
Is it possible to, like, knowing very well this person has a history of maybe high blood pressure or diabetes or whatever it is it possible to treat it maybe in the first trimester so that it doesn't end up showing in the second or third trimester?
So there are some medications we use to prevent them from happening again or to make them less severe should they happen again. There are interventions in place we do. But that does not change the fact that it's a high-risk pregnancy.
Okay.
Right. So when we check and the blood sugar is normal, because of the risk you had, along the line, we keep monitoring the blood sugar so that as soon as it begins to go high, we start medication.
Okay.
Some people have high blood sugar, they did not know. Some have high blood sugar they are aware of, but they are not taking the medications. The blood sugar is high and they conceive. A high blood sugar around the time of conception easily leads to babies not forming well. You can have a baby with no head.
A baby?
Yes. Particularly because in our part of the world, people don't attend what we call preconception care.
Okay.
Where, yes, you're a couple, you're planning to get pregnant, you come in and we check your blood sugar, your blood pressure, your thyroid, a few things, your sickling status, your blood group, a few of these things, just to see that if there are some things we need to correct to make you healthy before you embark on the pregnancy. So to avoid things like this.
Okay.
Twin or triplets, that's what we call multiple pregnancy. It's also a high-risk pregnancy. Because they are two, their demand on your body is higher. And then if along the line their positions are not good, you're likely to have premature labor and giving birth to babies that are preterm. Babies that are born preterm, they have a very high risk of dying. So that increases the risk. So then you have to manage at a place where we have the incubators and ability to take care of preterm babies.
Okay, sure.
With
this high risk, is it always about the age, or it can happen to anyone?
So it can happen to anyone, but the extremes of age come with added risk.
Okay, sure.
Women who are younger, the teens, adolescents who get pregnant, they face a lot of the risk, pre-eclampsia, eclampsia, and the risk of dying from the pregnancy and the complications of labor. Because
their systems are not fully
developed.
And the same thing relates to women that are in their 40s and 50s.
Yes, above 35 in particular.
Okay, sure.
What we call the advanced maternal age.
Okay.
So the streams of age pose some of this risk already, raise the risk of the pregnancy. Now, if somebody is pregnant and her blood level or the hemoglobin levels are low, what we call anemia in pregnancy, it's a high-risk pregnancy.
Okay.
Because, when women deliver, there's always a bit of bleeding. So if your blood level is already low and you bleed further,
you die.
You lose so much blood that if care is not taken to give you blood promptly, and like I said the last time, we don't have a lot of blood and blood products readily available. So if you're in that category and you lose a bit more of blood than the normal and there isn't enough blood for you, I'm afraid the worst may happen. So then you have to be managed at a level where there is ability to get blood and blood products for you. First of all, try to bring up your blood level during the pregnancy, and then also have blood available in the event you lose blood excessively after delivery.
Wow.
A woman who has had 1, 2, or 3 previous cesarean sections who is now pregnant, that is a high-risk pregnancy.
Why is that particular one a high-risk pregnancy?
Because if the placenta goes to develop in the lower part of the womb,
Yeah.
it can become something that can actually invade the wall of the womb and it results in the placenta being stuck after delivery. Then there's a danger.
Is it because of the history, the previous...
The cesarean, the scar, yeah.
Oh.
And then that can result in excessive blood loss and potentially life-threatening. A woman who has had a previous surgery to remove fibroids, who is now pregnant, it's a high-risk pregnancy because of the risk of the uterus tearing along the scar. You know, so these are some of the reasons why we'll categorize a pregnancy
As high
risk.
Okay.
Or somebody with sickle cell disease who is pregnant. It's a high-risk pregnancy because pregnancy leads to, sickle cell disease gets worse during pregnancy.
Okay.
Yes, to the extent that it easily causes mortality, especially if it is not managed.
It's not managed
at the right
properly.
level.
Okay, sure.
With the right expertise.
Finally, before you give us your final words, what are some of the things that you can do as a medical practitioner to minimize the risks of high pregnancy? The cases of high-risk pregnancy.
Right. So it begins with what I said, preconception care.
Okay.
So when you are planning to get pregnant, attend hospital, talk to your healthcare provider so that we can go through a series of checks to make sure you are fit. It takes a healthy woman to make a healthy pregnancy.
Okay.
Check your sugar, check your thyroid, check your blood pressure, check your sickling, so that if there are any concerns, we can address them, including your blood level. Then the whole point of antenatal care is to make sure we optimize your health and well-being.
Okay.
Screen you for risk, identify the risk, identify problems, solve them to make sure the pregnancy goes smoothly.
Okay.
So preconception care is very important. Regular antenatal care is very important. And then when you get asked to do things during the course of the pregnancy, please stick to them.
Okay, so the question I'd wanted to ask is, mostly when you're coming for antenatal and normal checkups, it's sometimes like every month, sometimes 2 weeks. So in cases of high-risk pregnancies, how often are they supposed to see the doctor?
So no 2 pregnancies are the same.
Okay.
No 2 high-risk pregnancies are the same. So there's something we call focused antenatal care. So depending on your risk level, we may say, let's see you every 2 weeks. We may say, let's see you every week. Sometimes we say, no, because you're a risk, let's admit you and manage the pregnancy until we deliver. So
meaning the person will have to be in the hospital for the full 9 months?
Yes.
Maybe.
Take, for instance, somebody got pregnant and developed blood clots in the legs. That is life-threatening because one bad movement, that clot will move, come and sit on the lungs. That's the end. So keep you in bed, put you on injections to help till that clot resolves. If it takes until delivery, that is what is safe for you. Or somebody has severe blood pressure, high blood pressure, that she needs to be on bed rest so that we buy time till the fetus matures before we deliver. So sometimes it's just necessary. Or somebody has had repeated pregnancy losses. It has just become absolutely necessary to keep them in hospital for close monitoring. To optimize the outcome of the pregnancy for both the fetus and the mother.
Is it possible to advise, to tell maybe, very well, maybe your first pregnancy was high risk? Looking at your situation, I think I will advise you not to try getting pregnant again. Are there situations like that?
Plenty. And we do.
Okay.
We do that. This was a near miss. We nearly lost you. So it wouldn't be advisable to conceive again. Sometimes they agree. Sometimes they say, you can't tell me what to do. Exactly, And it's sad that some of those people actually go ahead, get pregnant,
and they die.
And the worst happens. It's really sad. But now, with the advanced technology available, if you think you're not really done having babies, we can take your eggs, take your partner's sperm, fertilize them, and get somebody to carry the pregnancy for us. And that spares you all the risk, what we call surrogacy or gestational carriage.
Okay, sure.
Yeah.
Sure. Thank you very much, Doc. Please, your final words.
Yes, so it takes a healthy woman to have a healthy pregnancy and then for them a healthy pregnancy outcome. So preconception care, early booking as soon as you realize you're pregnant, and then you take your antenatal care and the advice pieces we give, the midwives will give you seriously, just so we optimize your health and your well-being during the pregnancy for the best and the favorable pregnancy outcome.
Thank you very much, Doc. And that has been Time with Your Gynae here on Health with Patricia. We come your way same time next week with another topic. Until then, stay blessed.